Hello and welcome everyone to the February TDI Health for Awareness monthly webinar. My name is Leisha Getson and I will be your host. To start, just a little housekeeping. We apologize for the technical difficulties last month. The webinar was not able to be aired live, but it is available now for archive. The Detox Cleanse webinar. It was a fantastic presentation and I strongly encourage everybody to go back and take a look. We will be extending the 15% off discount for the 14-day Designs for Health cleanse through the month of March. As far as our webinar this evening, you should be able to hear me as well as our speaker and see the PowerPoint presentation. All of the webinars are free and archived on our website, www.tdinj.com. Just go to the webinar page and you'll find them. So you can view this at any time, and please feel free to share with your family and friends. This evening's webinar will last about 45 minutes and it'll be followed by Q&A. To ask a question, just go to the right of your screen, type in the question and submit. We'll get to as many questions as possible at the end of the presentation, and please feel free to post your questions as you think of them during the presentation. So many thanks to our wonderful guest speaker tonight, Dr. Colette Hayes. Dr. Hayes will be discussing homeopathy, a system of natural medicine practiced for over 200 years, which is based on the use of natural elements as healing agents. Dr. Hayes has maintained a successful chiropractic practice in Spring Lake Heights, New Jersey for over 35 years. She attained her BA degree from Rutgers University and her doctorate in chiropractic from Life Chiropractic College. Dr. Hayes studied homeopathy with the renowned Dr. Luc de Schepper and earned postgraduate certification from the Renaissance Institute of Classical Homeopathy. She has practiced as a homeopathic educator for 15 years and has been the homeopathy professor in Georgian Court University's Holistic Health Program since 1999. On a personal note, I can say Dr. Hayes has a very, very warm heart and a generous spirit. She makes everyone who comes into her office feel welcome. She is very passionate about her work and truly understands the art as well as the science of medicine. In addition to being a wonderful doctor and educator, I'm honored to be able to call her my friend. So it's my great pleasure to introduce Dr. Colette Hayes, and we are all so looking forward to your presentation this evening. Welcome.
Thank you, Leisha. Hello, I am Dr. Colette Hayes, and I'd like to welcome you to the sometimes mysterious, always wondrous world of homeopathy. Before I begin, I want to thank the brilliant Dr. Philip Getson and his delightful, dedicated wife, Leisha, for inviting me to share some thoughts with you today. And I'd also like to thank my chiropractic and homeopathic patients, my students and former students, and my 3 daughters who encouraged and enabled me to pursue homeopathy. You have all made me a better person and practitioner, and you have my undying gratitude. So let's begin. Homeopathy is a safe, effective system of natural medicine used by millions of people worldwide for more than 200 years to achieve wellness. Homeopathic medicines are prepared from natural sources, are used in extremely small amounts, and are recognized by the U.S. Food and Drug Administration. They are non-toxic and, when properly administered, can be safely used with infants, children, adults, and animals. Homeopathy is based on the principle that like cures like. That is, if a substance can cause symptoms of disease in a healthy person, then it can cure a sick person suffering from similar symptoms. Suppose a person has hay fever with watery eyes and a burning nasal discharge. Instead of giving an antihistamine to dry up the discharge, a homeopath might prescribe allium cepa, a tiny dose of onion, specially prepared by a homeopathic pharmacy in accordance with FDA-approved guidelines, because onion is known to cause watery eyes and a burning nasal discharge. Homeopathy regards symptoms as the body's healthy attempt to restore itself to balance. A homeopath will choose a remedy that supports the symptoms, rather than opposing them or suppressing them, as in conventional medicine. Homeopathy recognizes that each person manifests illness in a unique and slightly different way. That is why 2 people with the same illness will not necessarily receive the same homeopathic remedy. A cold sufferer with a stopped-up nose and dry eyes would receive a different remedy than a cold sufferer with a runny nose and watering eyes. Unlike the one-size-fits-all approach often used in conventional medicine, a homeopath chooses a remedy that matches a person's unique symptom profile, including physical, mental, and emotional symptoms. Throughout its 200-plus year history, homeopathy has proven effective in treating diseases for which conventional medicine has little to offer. However, due to its low cost and natural status, it threatens pharmaceutical profits. It remains under attack by the conventional medical establishment. Yet, 500 million people worldwide receive homeopathic treatment, and those numbers continue to grow. The World Health Organization has cited homeopathy as one of the systems of medicine that should be integrated with conventional medicine in order to provide adequate global health care. I'd like to introduce you to the esteemed Dr. Samuel Hahnemann, the father of homeopathy, born in 1755 in Meissen, Germany. The late 18th and early 19th centuries was a time of upheaval and disorder throughout Europe, as well as a time of dreaded epidemics and wars. Hahnemann was born into poverty and into a large family. Early on, his gifts for languages became obvious as he became fluent in French, English, Italian, Hebrew, Greek, and Arabic. His linguistic gifts and translations of medical and scientific literature enabled him to study chemistry and medicine at the University of Leipzig. At the age of 24, he married and went on to father 11 children. Hahnemann soon became disillusioned with the state of medicine in his time and wrote articles criticizing the harsh medical practices of his day. These heroic practices included bloodletting, in which disease was thought to be caused by excess blood, so up to 4 quarts would be removed from a patient's veins. Our very own George Washington, a wealthy man with access to state-of-the-art medicine, died following a sore throat and breathing difficulties. During the afternoon and evening of his last day, he was bled 3 times, the equivalent of 4 quarts of blood, blistered and dosed with mercury. Also used was cupping, whereby extremely hot cups were applied to the patient's skin to draw blood to the surface. Harsh substances were then burned onto the skin to create an infection. The pus exuded was thought to remove disease. Also used was purging, in which large doses of drugs were used to induce vomiting and evacuate the bowels. And finally, calomel, also known as mercury chloride, was given in large doses to induce sweating and salivation and frequently death. Needless to say, he was appalled by the savage, brutal, and inhumane state of modern medicine. Hahnemann was one of the first of his time to advocate for better hygiene, sensible nutrition, fresh air, exercise, less cramped housing conditions, regular bathing, and clean bed linens. This was considered medical heresy at the time. He became so disgusted that he gave up medicine and became a translator to support his family. The year was 1784, and he was 29 years old. In 1790, while translating Dr. William Cullen's A Treatise on the Materia Medica, Hahnemann encountered the claim that cinchona, also known as Peruvian bark, was an effective treatment for malaria because of its astringent qualities. This made no sense to Hahnemann because as a chemist, he knew that other, more powerful astringents had no effect on malaria. He began to research cinchona, or quinine's, effect on the human body by self-application. Noting that the drug induced malaria-like symptoms in himself, he concluded that it would do so in any healthy individual. This led him to postulate a healing principle, that which can produce a set of symptoms in a healthy individual can treat a sick individual who is manifesting a similar set of symptoms. This principle, like cures like, became the basis for an approach to medicine to which he gave the name homeopathy. He continued to experiment with other substances, botanical, mineral, and animal, and cataloged the symptoms created in the healthy to create a drug picture for each remedy. In 1810, he published the Organon of Rational Medicine, outlining the theory and practice of homeopathy. He continued experimenting and treating patients and used more dilute doses and began a system of succussion or systemic agitation to make each remedy more potent. During his lifetime, Hahnemann proved the efficacy of over 100 homeopathic remedies. During the 19th century, Hahnemann's philosophy and practices spread rapidly from Germany across Europe to Asia and the Americas because of the tremendous success of homeopathic treatment for a number of epidemics, including cholera, yellow fever, and typhoid. Hahnemann died in Paris in 1843 at the age of 88. He worked every day of his life. He created a complete system of medicine, the only individual to have done so in his lifetime. By 1900, there were 22 homeopathic medical schools and 100 homeopathic hospitals in the U.S. alone. Early supporters included John D. Rockefeller, Mark Twain, Thomas Edison, and the entire English royalty, who remain advocates to this day. I'd like to now discuss the Spanish flu of 1918. Most people have never heard of or studied the Spanish flu of 1918. In all of my history courses in high school and college, whether world history or U.S. history, this has barely been a footnote. Yet it occurred in the 20th century, less than 100 years ago, and it killed more people than both world wars combined. It was the most cataclysmic loss of human life in recorded history. 1/3 of the planet's population was infected, and 50 million people died worldwide. Curious? I am too, so I decided to learn more about it and understand why it gets so little attention. This plague emerged in 3 phases, with the second wave being the most lethal, in the late summer and autumn of 1918, which is not typically flu season. It's been said that the disease struck with remorseless power and fury, wrapping its deadly stronghold around the globe like some giant, relentless python. The incubation was so short and the onset so swift that it killed within a matter of hours. Symptoms began with chills and fever, followed by delirium and hemorrhaging so severe that the blood of its victims turned dark and viscous, and they bled through every orifice and mucous membrane. It became known as the Purple Death. Also unusual was that it struck mostly healthy 20 to 40-year-olds, not the elderly and babies that we consider the most vulnerable. In the United States, 675,000 people died during this short period. Philadelphia reported 650 deaths in one day and 4,597 deaths in the week ending October 16th. 1/5 of all patients in hospitals were lost each night. Schools and subways and services were shut down. Mortuaries and funeral homes ran out of room, as did cold storage facilities. Bodies were dumped in cemeteries and makeshift mass graves. In New York City, 12,000 people died in the month of October 1918 alone. The plague did not discriminate. It was rampant in urban and rural areas, from the densely populated East Coast to the remotest parts of Alaska. Africa lost 2.3 million people. Europe lost 2.4 million. South America lost 1 million. North America lost 675,000. The Pacific Islands lost 250,000, and Asia lost 33 million people, with 18 million in India alone. 1 billion people worldwide were affected, and almost every family lost someone personally. So what happened? If you were infected and made it to a conventional hospital and you were treated with drugs, the mortality rate was 40%. You had a 60% chance of survival. If you went to a homeopathic hospital which were plentiful at the time, you experienced a 3% mortality rate, a 97% chance for survival. Aspirin and quinine were the wonder drugs of the day, but they actually facilitated death from the Spanish flu. We now know that aspirin poisoning in the treatment of viruses leads to death, as seen in Reye's syndrome. However, homeopathic remedies, particularly gelsemium and to a lesser degree eupatorium embryonia, helped to stimulate the vital force, and recovery was almost guaranteed. Imagine the horror and humiliation of the newly created AMA and the drug and pharmaceutical manufacturers that their state-of-the-art wonder drugs failed so dismally and so dramatically. Homeopathy was the savior that had to be destroyed for medicine to survive. It paid to suppress any and all information and facts and statistics related to this abysmal failure. Monumental and institutional efforts were made to systematically destroy homeopathy. So by the 1950s, the homeopathic medical schools were shut down and the homeopathic hospitals were closed. Every effort was made to erase homeopathy from the mainstream. While still flourishing and respected throughout the world, homeopathy's profound success became its downfall in the US, thanks to the overwhelming and unstoppable alliance of the AMA and the pharmaceutical industry. So, let's now examine the principles that define homeopathy. The first is the law of similars. The word homeopathy comes from the Greek homeos, which means similar, and pathos, meaning suffering. This principle states that any naturally occurring substance, botanical, mineral, or animal, that is capable of producing symptoms or disease in a healthy person can cure those same symptoms in a sick person. Homeopathic preparations are tested on healthy individuals to determine their effects. These effects are then used as guidelines for administering the proper remedy to the sick person. Earlier, I mentioned allium cepa, or red onion, which causes watery eyes and burning nasal discharge in a healthy person. It is used to treat those same symptoms of a sick person whose disease manifests that way. Similarly, coffee, also that we call coffea, a known stimulant which creates an excited or speedy state, will calm down an overly agitated child or help promote sleep for one who is overly excited at bedtime and experiences insomnia. So let's make sure that we all have the same understanding of what is health. For many, when asked, it's merely the absence of symptoms or disease. However, in homeopathy, as well as all disciplines of holistic care, health is an approach to life. We consider the whole person and how she or he interacts with their environment. We emphasize the connection of the physical, the mental, the emotional, and the spiritual aspects of the individual. In the balancing of these elements, we look at the physical as having strength, flexibility, energy, and freedom from physiologic malfunction. Emotional health as being able to acknowledge and express feelings, able to maintain rewarding relationships, and freedom of expression. Mentally, we mean the ability to think clearly, form ideas, solve problems, be creative, and make sound decisions. And spiritual, a belief and trust in a power greater than ourselves, giving a sense of meaning and purpose to life. Traditional doctors treat the body and ignore the mind. Conventional mental health professionals treat the mind and ignore the body. Our holistic health model integrates these elements and seeks to treat the underlying causes of symptoms rather than covering them up with suppressive drugs. We seek expression, not suppression. In our model, we recognize what Hahnemann termed the vital force, which is the body's attempt to restore and coordinate this balance. Vital force is the energy that animates all living beings. Other terms among many used to describe this is innate intelligence, which we use in chiropractic, chi, prana, the soul, even the immune system and homeostasis, which makes us shiver when we're cold, perspire when overheated, eat when we're hungry, as well as all the functions of the body that contribute to our daily life and survival. In homeopathy, we seek to stimulate the vital force with the correct homeopathic remedy to enable the body to heal itself. Unlike our medical counterparts, we view symptoms as defenses, the body's effort to heal itself. We look to every symptom as a clue to the cure. We are not only interested in the physical ones, but also how this symptom affects you mentally and emotionally. We're interested in what makes your symptoms better or worse, and herein lies the major difference in homeopathy versus medical treatment. We seek a deeper, detailed understanding of the individual. It's not one size fits all. Before recommending a remedy, we take into account lifestyle, diet, food preferences, level of activity and exercise, medical history, family history, effects of external factors such as time of day, movement, temperature, stress, and any other change or factor that makes the symptom better or worse. We listen, make observations, and seek to prescribe the most similar remedy that most closely matches the totality of the symptoms of the patient and therefore curative, allowing for a complete recovery and the restoration of health for you, the unique individual that you are. Let's now see how homeopathic remedies are prepared. Homeopathic remedies are made from plant, animal, and mineral extracts and diluted in varying degrees to avoid unpleasant side effects. Paradoxically, the more dilute the remedies are, the more effectively they work. The process of making remedies is very precise. For remedies derived from soluble substances, such as animal or plant extracts, the raw material is dissolved in an alcohol-water mixture. This mixture is left to stand for 2 to 4 weeks, shaken occasionally, and then strained through a press. The resulting liquid is known as the mother tincture. To produce different remedy potencies, the mother tincture is diluted in an alcohol-water mixture according to one of two scales, the decimal or X 1 to 10 scale, and the centesimal or C 1 to 100 scale ratio. So, to produce a 1C potency, 1 drop of the mother tincture is added to 99 drops of an alcohol-water mixture and succussed, meaning systematically shaken vigorously. To produce a 2C potency, 1 drop of the 1C mixture is added to 99 drops of an alcohol-water mixture and succussed. This is repeated progressively to produce the 6C, 30C, and 200C potencies you will find in your homeopathic pharmacy or health food store. The number shows how many times it has been diluted and succussed. So, the higher the number, the more diluted and succussed, the stronger the remedy. This paradox can be somewhat explained through nuclear magnetic resonance, NMR. NMR has been used to demonstrate subatomic activity in homeopathic remedies versus placebos. It is believed that the specific electromagnetic frequency of the original substance is imprinted in the homeopathic remedy through the process of successive dilution and succussions. The water molecules form structures capable of storing electromagnetic signals in the way that we know water is a great conductor of electricity. Hence, a homeopathic remedy may convey an electromagnetic message to the body that matches the specific electromagnetic frequency or pattern of an illness in order to stimulate the body's natural healing response. More and more research is being done in the field of quantum physics and energy medicine to fully understand the actions and efficacy of homeopathic remedies. Now let's get down to the practical applications of these wonderful, safe, and effective remedies to help cure the ills of everyday life. Thank God the influenza we have seen in the last few decades does not rival the intensity or severity of the deadly Spanish flu of 1918. While very serious and often debilitating, especially for the elderly and the chronically ill, today's strains of flu typically last for 3 to 10 days. They will eventually run their course, as many viruses do. Our goal in homeopathy is to at best prevent or at least shorten and modify its duration. Our first line of defense is the widely used and respected remedy called oscillococcinum. Readily available in drugstores, supermarkets, and health food stores, oscillococcinum works rapidly, especially at the first signs of the flu, often even preventing the flu from taking hold at all. In clinical tests, it has been shown to reduce the severity and shorten the duration of flu-like symptoms, including body aches, headaches, fever, chills, and fatigue. Gelsemium, the #1 flu remedy. It was used successfully during the Spanish flu pandemic of 1918 and is frequently used today for the flu. It is indicated for flus that come on suddenly and are accompanied by a dull ache in the back of the head and perhaps dizziness. There is a feeling of heaviness in the limbs, head, and eyes, and the person feels weak, lethargic, and apathetic. The eyes may be half closed. The muscles ache and chills run up and down the spine, alternating with fever. The person will typically have little or no thirst. Bryonia, another common flu remedy. This one is also useful for flus that develop slowly. The person will ache all over, especially in the joints, but will feel worse when moving in any way, so they tend to lie perfectly still. They are usually irritable and prefer to be alone. They may have a frontal headache that feels better when they press on it, and a dry, painful cough. They are thirsty for large amounts of cold water at infrequent intervals. Next, we'll see baptisia. This is for flus that come on suddenly with a high fever. The person may feel bruised and sore, have a dusky red face, and appear dull, as if they're in a stupor. They will be sweaty and very thirsty. Diarrhea or vomiting are often present. Eupatorium. This is for severe flus where the bones hurt so badly that they feel broken. The muscles may hurt too, and even the eyeballs may ache. The person may feel restless and unable to sleep. They are often thirsty for cold water. Eupatorium is also used for the treatment of dengue fever as well. Arsenicum. This is remarkably effective for what we call the stomach flu. Symptoms include vomiting and diarrhea, often at the same time. Chilliness, restlessness, and anxiety are experienced. There is a thirst for small, frequent sips of water. The person feels better with warmth, worse from cold drinks. Keep these and other flu remedies on hand during flu season. Take the indicated remedy in a 30C or 30X potency according to the severity of the symptoms. More often, if the symptoms are severe, like every 1 to 2 hours, and less often, every 3 to 4 hours, if they are not too bad. If you have taken 4 doses and have gotten no response, consider another remedy or seek professional help. Let's move on to issues that affect the health and well-being of women. A woman's reproductive cycle begins with the onset of menstruation and ends with menopause when menstruation ceases. Physical and emotional problems associated with this cycle are generally due to a hormonal imbalance. The homeopathic approach to women's problems not only take into account specific symptoms, but assess lifestyle factors such as diet and exercise in order to restore hormonal balance and improve overall well-being. Painful menstruation or menstrual cramps is common in teenage girls and young women. It tends to disappear after childbirth, though many older women have some discomfort during menstruation. Pain may be due to a hormonal imbalance, and stress makes it worse. The remedy magnesia phosphorus, or MagPhos for short, is often the first choice for relieving cramps. Cramps that are relieved from pressure and/or warmth. MagPhos may bring relief if your pains are cramping in character or feel like the pains of childbirth. There's also relief from bending forward. The pain, centered in the uterus, may radiate out in all directions. The woman who needs pulsatilla is usually very irritable. She is sensitive, moody, weepy, or depressed, and perhaps a little touchy. She wants and appreciates gentle comforting. The menstrual pains may be worse before or during the flow. Other symptoms can include dizziness, fainting, nausea, vomiting, back pain, and headaches. Also, the woman has no thirst, feels worse from heat, and open air tends to improve these symptoms. Belladonna is helpful when the pains tend to begin suddenly and end just as suddenly. They may take the form of cramps or something like labor pains. There may also be a feeling of intense weight and pressure in the lower abdomen and pelvis, sometimes as though the pelvic organs are about to fall out. Belladonna patients with these bearing down pains get relief from applying pressure to the genitals or abdomen. No matter what type of pain the woman has, belladonna is indicated when motion, walking, or being jarred worsen it. Sitting bent over often aggravates the pain, whereas straightening up makes it better. Pain may extend from the region of the uterus to the back. Headaches before and during the menstrual periods are also quite common. Menopause. Menopause is the cessation of menstruation and usually occurs in women 45 to 55 years of age. Symptoms, which include hot flashes, sweats, vaginal dryness, and anxiety, can be especially severe if menstruation stops abruptly, either naturally or following the removal of the ovaries. We'll once again take a look at belladonna as it relates to the relief it can offer during menopause. As is characteristic of belladonna, the symptoms of menopause that come on strongly and suddenly will benefit from this remedy. Emotional symptoms include one who is sensitive, excitable, intense, and restless, especially in bed. Also seen are severe hot flashes. The head is boiling hot while the hands and feet are icy cold. The flashes produce profuse sweats, and a bright red flush spreads over the face. Also possibly experienced is stress incontinence when walking or standing. Throbbing headaches, nosebleeds, and insomnia with twitching, jerking, and grinding teeth are also seen. The symptoms for which lachesis could be most helpful are characterized as being worse in the morning upon awakening. Being suspicious with a tendency to talk too much is a classic expression of lachesis, as are mood swings, depression, irritability, and anxiety. There is a feeling of congestion all over the body, difficulty breathing, and headaches usually worse on the left side. She will have hot flashes which will disturb sleep. However, there will be little to no sweating. Also typical of lachesis is an intolerance to tight clothing, especially around the neck. This is one of those unusual symptoms which will often guide the provider to recommend lachesis. Final to our discussion of menopause is sepia, but I assure you, there are myriad other remedies to assist in the management of menopause. I have selected these as they embrace many of the discomforts women may feel during this life stage. One of the keynotes of sepia is that she feels better with vigorous exercise, and she is depressed, apathetic, especially to family, and irritable. She easily snaps at loved ones or indeed anyone. She can be weepy, but does not want company or sympathy. Hot flashes are accompanied by drenching sweats with overall exhaustion. There is a dragging down sensation in the lower abdomen and a dry, painful vagina and recurring yeast infections. Sepia has brought relief to many a woman who suffers through menopause. So I hope to stimulate your curiosity and cultivate your interest and confidence in giving homeopathy a chance to help treat the ills of you and your family so that you may experience the optimum of health and wellness. Homeopathy is safe, gentle, and effective, and our ultimate goal is to support and stimulate your vital force to enable the body to heal itself. I have compiled what I believe are the top 12 remedies to have on hand in your home. With these, whether you're a newcomer to homeopathy or a seasoned prescriber, you will come to experience a healthy, gratifying outcome without the unwelcome side effects of drugs and empower self-healing and enhance well-being. With these remedies, I recommend the 30C dosage. Generally give every 2 to 4 hours at first and less frequently as the patient improves. If no improvement is noted, consider another remedy. I'm including a key symptom for each remedy. This is merely a guide. Please consult a homeopathic text or homeopath for additional information. So, our first remedy, let's begin with the most famous and widely used of all remedies, Arnica montana. Arnica is our #1 remedy for first aid. It is when there is a sudden shock to the body of any kind, from a blow or a fall. It is used to reduce bruising and swelling in the affected area. It's for any trauma, physical and/or emotional, aches or injuries from physical exertion, like overlifting, yard work, overexertion of muscles, at the gym. It's used beautifully before and after surgery to help reduce the trauma to the body. Very helpful in the effects of dental work and also in recovery from childbirth. The second is aconite. Aconite is for the sudden onset of anything, like a cold or a fever. There is great thirst, dry skin, and ailments that are brought on by exposure to cold or a cold, dry wind. Also, a keynote for aconite is fright. It's a fear remedy. It's very helpful with panic attacks and has been noted and called the homeopathic Valium. Aconite was also a major remedy that Hahnemann used in the treatment of measles in his day and brought him great notoriety. Next is apis. Apis is used for bee stings, as apis is derived from the venom of the bee. It's used for allergic reactions where there's swelling, stinging pains, reactions from insect bites, sunburns, symptoms that are better from cold applications but worse from touch or pressure. Apis is used to treat hives and the PMS water retention that many experience. Again, we see arsenicum. I must say, the energy from great poisons make great remedies in homeopathic doses. Arsenic or arsenicum is used to treat nausea, diarrhea, and is the #1 remedy for food poisoning. It is used for gastric distress and is usually accompanied by restlessness. It is a wonderful treatment for asthma as well as the flu, as previously mentioned, where the patient feels weak and chilly. They say when traveling, don't leave home without it, as it will be so helpful if you experience any difficulty with foreign foods. Belladonna. Belladonna's keynote is inflammation. Any inflammation, the sudden onset of fever, for headache, sore throat, earache, heat stroke, tonsillitis, where there's a hot, dry, red tissue, dilated pupils. The patient is thirstless and better from warmth. It is excellent for treating infections and is noted by throbbing pains and redness, and includes the treatment for migraine headaches when there is much throbbing, particularly in the temples. Bryonia. The keynote for bryonia is everything is worse from movement. The slightest movement aggravates the patient. That's why it's such an excellent treatment for migraine headaches. For the classic migraine, the patient can't stand movement or light or noise of any kind. This is a classic bryonia presentation. It's also used for the flu and for the slow onset of symptoms. The patient will have much thirst, irritability, and fatigue. Treatment for arthritis, back pain, sprained ankles, and rib pain responds very well to treatment with bryonia. But remember, the keynote here is everything is worse from movement. Next, we see calendula. Calendula aids in the healing for cuts, abrasions, open wounds, bleeding gums. Calendula helps the body heal faster from any wound. It can be used as a mouthwash in tooth extractions or as a cream topically. It's also used frequently post-surgically to help facilitate healing. Carbo-veg. Carbo-veg is noted when there is much bloating, belching, flatulence. Also, one who is recuperating from a debilitating illness will benefit from carbo-veg. And it's a very good treatment in the later stages of pneumonia and the treatment of asthma, as well as effects from high altitudes, such as headache, shortness of breath, and palpitations experienced if you've ever traveled out west and been in the mountains in Colorado or Wyoming, and you experience altitude sickness, carbo-veg is your friend. Ferrum phos. Ferrum phos is noted with a gradual onset, unlike the quick and rapid onset noted in aconite and belladonna. It's for the first stages of colds and flu with fever and inflammation. Ferrum phos is used to treat sore throats, bronchitis, and it's excellent for nosebleeds. Next is my old friend Rustox. As a chiropractor, it is one of my favorite remedies because it's very, very helpful in the treatment of arthritis. And its keynote here is pains that are better with movements. Particularly that rusty gait syndrome, say in a shoulder that's very stiff, but as you increase the range of motion, it gets better and better. The pains get better with movement, a classic arthritis presentation. It's good for rheumatism when one feels better from heat. It's also very good for itchy skin rashes, poison ivy, poison oak, and any kind of soreness in the neck or the back. Gelsemium. Back to gelsemium as our #1 flu remedy, but another wonderful use for gelsemium is for anticipation anxiety. As you anticipate an event, such as an examination or giving a speech in public speaking, a dose of gelsemium beforehand will bring you that calm spirit in which to proceed effectively. It's good for stage fright as well as the flu, and also from the effects of hearing bad news. When you hear bad news on a health front or from a loved one, you go into that kind of trembling, numb state. Gelsemium will help move you towards processing that information more effectively. It's a beautiful remedy. And finally, Coculus. Coculus is our #1 remedy for motion sickness, particularly in the car or airplane sickness. But unlike over-the-counter remedies, it doesn't cause drowsiness. And it's a wonderful remedy for jet lag. If one takes jet lag as you get on the plane and as you exit, you'll find the jet lag's incredibly minimized. So in closing, think of homeopathic remedies as a spark, a healing spark, a catalyst that can move the patient and not just their symptoms toward healing. The homeopathic treatment will leave the patient not just symptom-free, but actually stronger and healthier than before. We recognize first and foremost that those symptoms are there for a reason, affecting the whole person. So whether you're a newcomer to homeopathy or a longtime advocate, I strongly urge you to add homeopathy to your arsenal of self-healing and consider it as your first course of action. Be confident that you can provide relief and often cure the discomforts and illnesses of our modern day lives. Thank you for joining me this evening. We will now open up the discussion for your questions.
Well, thank you, Colette. That was a fascinating webinar, and the explanations were so thorough. You know, I feel like I do have an overview understanding of what you talked about.
Thank you, Leisha.
Yes. What can I just ask a question? Would somebody be able to purchase homeopathic remedies? Should they do it on their own or under the care of a homeopathic physician?
Well, that's a good question, Leisha. And I would say that for acute situations, self-limiting situations that you'll encounter, like, you know, like treating the flu or headaches or stomach ailments that are self-limiting, you can. There are very good guides that are available online and even in health food stores. Boiron is a manufacturer that has remedies and often gives descriptions of how those remedies can be used. So, I mean, there are excellent texts out there that I use in my class at Georgian Court University that are very, very helpful in helping guide you to the remedy choice. However, for severe conditions or for chronic illness, I feel it is best to consult a homeopath or homeopathic physician for the guidance that you would seek in a chronically ill situation. But I really want to encourage our listeners to look at acute situations in which there's so many ways you can help your family, you know, deal with childhood maladies and colds and coughs and digestive issues that are on a more acute level that are remarkable outcomes that you can achieve. So I hope to give you some confidence in which to go forward with those.
Yeah, yeah. So can you say the name of that text or the company?
Yes.
Can you spell that for us?
I will. One of my favorite books to recommend is called Everybody's Guide to Homeopathic Medicines. Again, that's Everybody's Guide to Homeopathic Medicines by Stephen Cummings, Cummings, and Dana Ullman, Ullman. Dana Ullman is one of the most prolific homeopaths of our day, and he has wonderful articles to offer. But this book, Everybody's Guide to Homeopathic Medicines, is a wonderful, wonderful resource. As is Dr. Luc de Schepper, with whom I studied homeopathy, has a book called The People's Repertory. It is a wonderful guide for first aid and acute situations, and it's very concise and very easy to read. So those two books are really my favorites for the newcomer, and even for me, who've been working with homeopathy for a long time.
Mm-hmm.
These are the books I always refer back to: Everybody's Guide to Homeopathic Medicines and The People's Repertory.
Okay, that's great. And so, is there a certain brand that you would recommend? And in the supplement world, not all supplements are created equal.
Mm-hmm.
Something that you would find in Whole Foods or, as you said, in a health food store.
Sure. One of the major brand that's readily available is by a French company called Boiron. That's spelled Boiron. Boiron. They are the gold standard, really, for homeopathic remedies. But there are other companies, American Standard and Washington Homeopathy, are also very reputable. But the most commonly available, and certainly for the newcomer just starting out, Boiron will give you a comprehensive array of remedies to choose from.
Okay, that's very helpful. If you are taking, and I wrote down, for instance, when you were talking about menopause, with all of those, that was amazing information about the symptoms there.
Mm-hmm.
Can somebody take a combination? For instance, I wrote down, and I don't know if this was specifically for menopause, aconite and gelsinium.
Well, in classical homeopathy, in classical Hahnemannian style, you would take one remedy at a time. He was an advocate for the single dose. So if you felt that aconite best fit the picture, if there was a lot of fear and fright and a sudden onset, you could certainly give it a try and see if it affected your symptoms. And if not, then look to gelsemium or look to, sepia or lachesis, whichever one seems to fit the profile the best. So, I mean, give it we're all detectives here. We're
Right.
all, trying to read the clues on identifying every aspect of the condition to match it to the totality of the remedy. Or so that it's not, you don't always win. You don't always get what we call the simillimum, or that home run remedy that as soon as you take it, like your symptoms disappear. When you do, you're overjoyed. But
Right.
oftentimes you can get what they call the similar or a close match. And oftentimes that will give you enough relief to bring you to the next stage. And then maybe that would indicate a different remedy because the emotional state may have changed or some of the physical symptoms may have changed. So then you would relook at the remedy and say, well, which one best matches this? So oftentimes one will do it. But if not, the picture will change. So you want to retake the case, take a second look, be a good
Okay.
detective, look at the
Right.
current clues, and then base your selection from that.
Okay, thank you. And I think if I remember correctly, did you say that if you take a remedy 4 times and you do not have relief, to maybe move on to something else?
Well, that's my rule of thumb. I mean, if you've given it a good chance, you think you've matched, you think you've hit on the remedy that best matches it, but you're not getting the result. The situation is not moving forward in terms of moving towards the cure. I would think that's a good gauge. Like 4 times you've done it, that would probably be over a period of like 12 hours, say every
Okay.
3 to 4 hours. And after 12 to 24 hours, and you're not seeing any movement on the case, I would take a second look and say, okay, let's look at this again. And like I said, there's so many nuances that you may have overlooked something that made it better or worse, like thirstiness or the effects of warmth and heat. So that can help guide you to another remedy. And I'll tell you, that's one of the beauties of the Cummings and Ullman book, Everyone's Guide. It gives you an array of remedies for a specific condition. So it's a good guideline to be a good detective, to do good case taking. Better the case taking, where you identify the subtleties, the closer you'll get to the remedy.
Gotcha.
But it doesn't have to be that complicated. I don't want to overcomplicate it. I mean, it's generally you have a pretty good sense of it with the major remedies. But if you do hit a roadblock, it's time to look at another one.
Okay. Good enough. And just one last question for my information. Do you know how many homeopathic schools there are, or where can somebody study homeopathy?
Wow, that is a good question. I would go to the National Center for Homeopathy online, and
Okay.
they are an excellent resource for everything homeopathic. Not only the schools, but also they'll any kind of seminars that are being offered or conventions. Like that's kind of the clearinghouse for homeopathy or homeopaths today. I am a member, and most homeopaths are. So it's the National Center for Homeopathy. So if you Google that or go to the NCH website, you can find out all that information.
Okay. All right. Well, thank you very much. And let's get to some questions here. Donna asks, what can someone with high cholesterol use that is homeopathic?
Well, I wish there was like an easy answer for that. High cholesterol is not many different people and many different presentations of result in high cholesterol. So one would have to really take the case and understand the whole person before we don't treat conditions. We treat individuals whose body manifests different symptoms or conditions. So, I mean, high cholesterol is only a piece of the puzzle.
Mm-hmm.
There's other aspects. What makes this person, what stressors are in their life, what are the other aspects of their diet, their exercise. And before you would come up with a remedy, you'd have to look at the factors of that individual to see how can we best stimulate their vital force to affect a cure. But I'd need a lot more information about that individual before I could say, this one remedy is good for that. That's really not truly how homeopathy works. It's, again, understanding the whole person. So
Okay.
there's a number of factors to consider, and that's a more detailed discussion.
Okay. And Dr. Hayes, do you do homeopathic consults in your office?
I do on a limited basis. My major focus is really as an educator, and teaching homeopathy in the master's program at Georgian Court University. They have a wonderful a master's degree offer in holistic health, and I'm really proud to be affiliated with that program. And I will be teaching homeopathy again in the spring of 2017, next year.
Mhm.
So that's my main venue for homeopathy. I do, have a smaller practice, and it's really because first and foremost is my chiropractic practice, and that has really consumed so much of my time and energy that I've kept homeopathy more to an education level, but I do occasionally take a case if it's presented to me.
Okay, thank you. Kim asked, how do you go about finding a homeopathic practitioner pediatrician? She says she's in South Jersey, and I think then somebody went on to answer the National Center for Homeopathy. Is there anything else that you would offer?
I'd have to research that. There really aren't too many, unfortunately. Like New York City, urban areas seem to be centers more for more enlightened approaches to childcare, unfortunately. I don't know of anyone in South Jersey. I wish I did, but if I do, just go through my desk here, my journals. If I find one, I will definitely let you know.
Okay, great. Thank you. Donna says this is sounding like traditional Chinese medicine. How similar are the two?
Well, I'm not as versed in traditional Chinese medicine, but I have enormous regard and respect for it. I mean, Chinese medicine's been around for thousands of years and would certainly be an avenue that I would consider if I was dealing with chronic illness as well. I would incorporate as many modalities that are consistent with our model of health to pursue wellness. And I mean, I have respect and reverence for Chinese medicine, and I would seek counsel on that level as well. So it's all very compatible. I believe all of our holistic health remedies are very compatible because of our model of health. We are interested in the whole person. We are interested in the most benign and safe ways to treat illness. So even as a chiropractor, I recommend acupuncture, homeopathy, an integrated approach to health. And within that of course, a place for traditional medicine as well. I would never negate that. Mm-hmm. There's room for all of us, and there's an appropriateness to various treatments. So I would respect and regard all of these practices that are very well established as avenues to pursuit, even in the presence of traditional medicine. You can still complement traditional medicine with homeopathy and acupuncture and traditional Chinese medicine.
Very well said. Yes. So what else do we have here? What causes the body's natural healing response to languish?
Diminished vital force. I mean, through repeated stress, through lifestyle. I mean, if one is not experiencing optimal wellness, it's probably because of many years of really not being in tune, say, or because just a diminishment of the vital force. I mean, it does happen with time, and as we age, we have to work harder to stay healthier. But I would say it's something where you have to look at the whole person and their whole approach to life, and find areas where there can be improvement. So homeopathy has a major role there, but so does diet, nutrition, exercise, lifestyle, and the hugest of all is stress. I can't emphasize enough how stress will diminish and really suck away the vital force. Right. Dealing with stress effectively and efficiently is our number one way to stay healthy.
Right. Yes. Yeah. How do these remedies work with taking traditional medications? Any interactions, side effects?
Thank you, whoever asked that. That is a great question. The beauty of homeopathic remedies is that they're energy medicine. They the actual substance from the mother tincture on through the potencies is really, is not really there. It's the energy. It's the energy of arsenicum. It's the energy of arnica that relates to the vital force and stimulates the cure. So it's a whole different pathway than traditional drugs. Traditional, medications and drugs are, chemical reactions in the body. So the beauty is for the most part, I would say, homeopathic remedies do not in any way interfere or exacerbate or diminish the effects of traditional medicine.
Oh, very interesting. That's great to know.
Yeah, they can be used together effectively. Of course, I would like to see the homeopathic, allowing the homeopathic remedy to work, but I certainly regard and recognize the need for medications, but I still feel that there's a place for homeopathy, and it's used more and more. I mean, more and more traditional doctors are using it, certainly in like surgery protocols, like I mentioned before, like using arnica before and after a surgery to help diminish the trauma to the body. I mean, any surgery is traumatic to the body, and arnica promotes healing. I've heard many medical doctors say it's like a profound healing effect that for one who has taken arnica after surgery and calendula because of the cutting, as opposed to one who hasn't. So it's
that's fantastic.
Yeah, it's a formula I've recommended to people who are undergoing surgery, using arnica and then after surgery calendula to facilitate healing. Although use them separately. Again, when I'm about the single remedy,
Right.
you take them one at a time. You don't like make a mishmash of them all together. Classically, they work best. You don't want to confuse the vital force. You want to give it one stimulant at a time.
Okay, and so should you take your for instance, if you're going through a surgery, should you take the homeopathic remedies alone, not with, say, your supplements or your medications, or doesn't matter?
Well, it's always best. Thank you also for asking that. It's best to take homeopathic remedies on their own. In other words, you don't want to take them with food. And there are certain items that actually will cancel out or diminish the effects of homeopathic remedies, including strong substances such as coffee, mint, toothpaste, mouthwash. Those strong aromatic astringent type substances can cancel out the effects of the remedy. So you want to take the remedy alone. Let it be the only thing that enters your body at that time. So for instance, you would take it like 30 minutes before a meal or 30 minutes after a meal. But when it's the only thing that enters your body, let that be the only thing that your body has to deal with and register, is that homeopathic remedy. Of course, you can always take it with water. That's the one exception.
Okay.
Water is always, actually, water just helps to facilitate the remedy.
Okay, and are they best taken under the tongue?
You can take it under the tongue is how most people are taking them. They come, if you see, when you see the remedy, the blue tubes they're called, or the Boiron, the way they're manufactured, they're in little pellets, and it's best not to touch them if you can. Just they have a very nice dispenser where you twist the bottom, and the remedy drops one at a time into the cup, in a little cup in the cap, and then you put it right under your tongue. And try not to touch it because the oils on your skin can, affect the efficacy of the remedy. So that's the purest and best way to take them. And you could also, if it's easier and sometimes more manageable, is to dissolve that remedy in water, in a bottle of water, and then take sips of that throughout the day. That is another effective way to
that's a great
administer
idea.
remedy. Yeah, it really is. If you're dealing like arnica, like you've had a blow and you have pain from exertion, and you make a bottle of arnica. So you take like 3 pellets, put it into the bottled water, and then take sips of that water throughout the day. That remedy will last you all day long and will repeatedly, reinforce the healing that you're striving to achieve.
Great idea. Kristen asks, can calendula be a remedy for eczema as well?
Calendula wouldn't necessarily be my first thought for eczema, although I understand where you're coming from with the redness of the skin. Eczema, another very good skin remedy is a remedy called sulfur, Sulphur, homeopathic sulfur. is a very, very is a remedy that I might think of first because it has that red skin as well. Although I see what I see where the thought for calendula would come from. I think I would try sulfur first, and then perhaps calendula, or even apis, at that time. So this is where sometimes you have to kind of go with your instinct or your gut, and sometimes you have to work with a few remedies before you start to see a result. But and also for eczema, there is a homeopathic topical cream called Florasome, 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 that I have seen. It's a homeopathic topical ointment that I have seen very effective for the management of eczema.
Okay, great. Kim asks, do the books you recommend address childhood remedies as well?
Oh, yes, they definitely do, particularly the Cummings and Ullman book, Everybody's Guide to Homeopathic Medicines, has chapters devoted to childhood maladies, as well as coughs and colds. But specifically so, yes, the childhood maladies are covered in that book. And the other chapters also, as they relate to childhood coughs, colds, digestive disorders, fevers, that's all covered in there. But they do make a point, Ullman and Cummings make a point of addressing childhood maladies specifically.
Okay, great. It looks like Leslie has posted 2 websites that may be answering that question also. Kim, do you have time for 2 more questions, Dr. Hayes?
Yes, I do. Sure.
Okay. Leslie asks, is homeopathy used for cancers?
Yes, I would say yes. I would say in the case of cancer, there are so many treatments and many of them are very aggressive. So I would say that homeopathy, yes, is used for the treatment and management of cancer. There are remedies, specific remedies for the different types of cancer. There's so many different manifestations, unfortunately, of cancer. But there are remedies that are specific to different types of cancer.
Okay. And lastly, Kim asks, is dosage based on weight, meaning how would children's dosages be different than an adult?
That's really good question, and the answer is it's not based on weight. 30C is 30C. 30C stimulates the vital force very effectively, and you do not have to adjust. The beauty of it with children, and that's one thing, with children, with babies, and animals, the effects of the homeopathic remedies are oftentimes so profound because you're not going to get that placebo effect. You're not going to get the patient who wants to make you feel good, by saying that it helped them. Either the dog walks or it doesn't walk, or, it is fatigued or is vibrant. That baby and animals are wonderful provings for us because you take away that whole mental emotional part of it and you just see the reactions in its purest form. But getting back to babies, no, babies have the strongest vital force of all. So they tend to respond very quickly and efficiently with homeopathic remedies. That's a joy to work with children because their vital force just bursts and jumps for joy when it encounters homeopathy.
That's very interesting. Yeah, that's great.
Mm-hmm.
Well, thank you so much, Dr. Hayes, for this fascinating look into homeopathy. I think the information presented is invaluable, and we just thank you for your time and your expertise and knowledge.
Oh, it's been my absolute pleasure. Thank you so much for having me.
You're welcome. So join us next month for our webinar, which will be on Wednesday, March 23rd at 7 p.m. Our speaker will be Elsie Kearns. In this webinar, Elsie will be discussing the relaxation response. It was researched by Dr. Herbert Benson, author of the book by the same title. And she's actually going to be taking us through in addition to describing the relaxation response, she's going to be taking us through a guided meditation. So you don't want to miss that. It's going to be great. So if you like the information and the service that TDI and Health Through Awareness is providing, please take a moment and let us know with a positive Google review. Thank you all for joining us this evening, and thank you again, Dr. Hayes, for a wonderful presentation. Good night, all.